is Crystal Johnson Wesley, and I will be completing a comprehensive health assessment for nursing 609. Can you state your first and last name
Rajon Wesley,
and your date of birth?
3/24/81,
Can you state the current month and year?
August 2018,
And can you state the city and state where you are now?
LaPlace, Louisiana.
And can you name the current U.S. president?
Donald Trump.
Perfect. So the patient is awake, alert, and worried at times 4. The patient is calm and cooperative. General appearance, the patient is well developed, calm and cooperative, with good hygiene. So the first thing we're going to do, prior to recording, I obtain the patient's height and weight, and vital signs, and the patient's BMI. And I'm going to step outside of the frame just for a moment to conduct an acuity test using the Snellen chart, and that's also an assessment of cranial nerve 2, the optic nerve. Okay? Can you read the line that you can see clearest, the lowest on the chart?
FET D E F T O P E C.
Okay. So the patient was able to correctly read line 8, which is 20/20 vision, and that means that the patient is able to see at 20 feet what someone with normal vision would see at 20 feet. So I'll start my assessment with the hair. The hair appears to be evenly distributed along the skull. The scalp is clean, no redness, dryness noted. Okay, you can move your head. The skull is symmetrical and well approximated. I'll start with the frontal sinuses. Start with the sinuses. I'm going to touch your face and you'll let me know if you feel any pain or tenderness. Frontal sinuses, any pain or tenderness?
No.
Maxillary sinuses, any pain or tenderness?
No.
Okay. So now I'm going to assess the eyes. Can you open your eyes for me? The scleras are white bilaterally. No abrasions noted. The inner and outer canvases are well approximated and seen. Pink and moist, no redness there. The conjunctiva is pink and moist, no drainage or erythema noted. Let's take a look here. Just gonna check pupils. Look straight ahead for me. All right. The pupils are 2 millimeters. They're equal, round, and reactive to light and accommodation. And that's also cranial nerve number 3, ocular motor. So we'll move on. Sorry, my lights. I'm gonna take a look in the patient's nose. Can you look to the ceiling for me? Okay. The nasal mucosa is free of lesions and or erythema. The septum, the nasal septum, is free of deviation. Can you open your mouth for me? All right. Lift up your tongue. Stick out your tongue. Smile for me. Puff out your cheeks. Perfect. The oral mucosa is pink, moist, free of ulcerations. The pharynx is nice and pink, no erythema. The gums are in good health, no evidence of gingivitis, good oral dentation. I had the patient smile, puff out his cheeks, stick out his tongue. That's also assessment of cranial nerve 7, facial nerve. Now I'm going to take a look at the ears, the auricles, or symmetrical bilaterally, no lesions or nodules noted. Uh-oh. I'm gonna take a look in the ears. I'm leaning it towards me a bit. This is gonna be painless. Alright, so the ear canal is clean. It's free of any erythema. The tympanic membrane is gray, pearly gray. No evidence of ear infection there. All right, and leaning it towards me, and all right, ear canal is clean, tympanic membrane is noted, nice pearly gray, no foreign bodies noted. Make sure the light is on here. There we go. Okay. All right, I'm gonna take a look at the eye again. Just look straight ahead. Look straight ahead, kind of lean in toward me. Okay, the retina is intact. The fovea, the fundus is noted, as well as the optic disc. And bend a little bit, yep. And then look straight ahead. Okay, good. Alright, the retina is intact. The fundus And the optic disc is noted. No evidence of cataracts noted. Okay. Now I'm going to assess the lymph nodes. The pre-auricular, let me know anything your tenderness.
No.
Post-auricular,
No.
okay. Tonsillar,
No.
submental,
No.
submandibular,
No.
occipital,
No.
posterior cervical chain,
No.
supraclavicular,
No.
intraclavicular.
No.
Okay. I want to ask you to remove your shirt, please. And throughout the assessment, the skin assessment is continuous throughout the assessment. So at this time, I'm going to also assess the posterior and anterior chest wall for any lesions. I'm going to take a look at your neck first. Okay. The trachea is midline. Want to assess the carotids. Two plus. Auscultate the carotids using the Bell microscope. Okay, no bruit noted bilaterally. Can you lean that just a little bit for me? Assessing the jugular vein, no jugular distension noted. Okay, can you pick that up? Palpating the jugular vein. Okay, 1 plus. 1 plus. Again, the trachea appears to be midline. Can you swallow for me? All right, I'm going to assess the thyroid. Please swallow once more. Good. Okay, displacing the gland slightly to the right. No nodules noted. Displacing the gland slightly to the left. No nodules noted. Okay. All right, so taking a look again at the anterior and posterior chest wall, it's free of lesions, the skin is intact. Can you take a deep breath for me? And again. Also, expansion is symmetrical bilaterally. Take a listen to your lung sounds. So it's going to be a deep breath in, deep breath out, okay? Deep breath in, deep breath out, deep breath in, and out. Deep breath in, and out. Deep breath in, and out. Okay. Deep breath in, and out. Deep breath in, and out. Okay, lung sounds are clear. Bilaterally, anteriorly, and posteriorly. At this time, I'm going to check for tactile fremitus. I'm going to ask you to repeat 99 for me. I'll tell you when. 99.
99.
A little louder. 99.
99.
99.
99.
99.
99.
99.
99.
99,
99,
okay. 99,
99,
99,
99,
99,
99,
99,
99,
okay. So the patient is negative for tactile firmness. Let's take a listen to the heart. Gonna listen at the point of maximum impact. Okay, S1 and S2 noted. All right, so, now I'm gonna go back to the lungs and I'm gonna percuss. Take the deep breath in for me, hold it. Okay, let it out. Deep breath in. Let it out. Deep breath in. And out. Okay, deep breath in. And out. Deep breath in. And out. Okay. Now we'll move on to the abdominal assessment. Can you lie back for me? And you can raise your hands above your head. I'll check your axillary lymph nodes. Any pain?
No.
Okay. Any pain?
No.
All right. So the patient's abdomen is obese. It is symmetrical. And I'll take a listen. Bowel sounds are positive in all 4 quadrants. And I'll start with light palpation. Please let me know if there's any pain or tenderness. No pain or tenderness noted on the light palpation. No masses noted. I'll continue with deep palpation. Please let me know if there's any pain or tenderness. No pain or tenderness noted on deep palpation, and no masses or nodules noted as well. Okay, I'm going to assess the spleen. Take a deep breath in. Okay, no splenomegalia noted. And take a deep breath in and hold, and I'll assess the liver. Okay, no hepatomegalia noted. Deep breath in. So I was able to palpate the lower edge of the liver. All right, now we're gonna assess the arteries. We'll start with the femoral, the pulses, femoral pulse. And while I'm there, I'll assess the inguinal lymph nodes. So we'll do the inguinal first. Any pain or tenderness?
No.
Okay, and then we're assessing the femoral arteries, the femoral pulse. It's 2 plus bilaterally. The popliteal, 1 plus. And the peel is 1 plus. Can you rub your heel against your right heel against your left shin? Okay, and can you rub the opposite? Okay, so that's Romberg. Can you sit up for me? The Romberg test. I'm going to assess the radial pulse. Brachial. 2 plus bilaterally. Now I want to assess deep tendon reflexes. If you can, just hang your hand by your side, feeling for, just start on this side, feeling for the tendon. Okay, so this is assessing the bicep tendon. Okay, 2 plus there. Okay, bicep contraction noted. Assessing the brachial radialis. Yep, 2 plus there. Very good, 2 plus there. I'm gonna assess the tricep. Hold it to the back, yeah. 2 plus there. And 2 plus there. Okay, so we're gonna assess the popliteal. All right, 2 plus. 2 plus, and then Achilles. Achilles is 2 plus. All right. That's the assessment of the tendon reflexes. We're going to move to cranial nerve assessment. And we did conclude that we did complete the optic nerve, the optic cranial nerve assessment with the Snelling chart. So we'll start with the optic cranial nerve number 1, the olfactory nerve. And Can you tell me what you smell there?
Rubbing alcohol.
Okay. And that is, woo, and that is correct. The olfactory nerve is intact. Again, as we stated, we've already tested the cranial nerve 2, the optic nerve. We've also already tested cranial nerve 3, ocular motor nerve, pupil constriction. We'll test cranial nerve 4 and 6 together. That's the trochlear and abducens nerves, and those nerves control eye movement. Trochlear controls movement towards the face, and abducens controls movement laterally. So, let's see, just without moving your head, just using your eyes, follow my finger. Very good. Those cranial nerves are intact. We'll go back to the trigeminal cranial nerve, which is cranial nerve 5. So if you can close your eyes and tell me if you feel the sensation of sharp, dull, or soft. Okay?
Dull.
Okay, let's try this one.
Dull. Soft.
And now this one.
Sharp.
Fantastic. Okay, I'm gonna try it again. So now that you know what the how it feels, this is okay.
Soft.
Okay.
Dull.
Okay. So it is noted that the cranial nerve is intact, the trigeminal. We've already concluded that the facial nerve was intact when the patient was able to smile symmetrically, puff out his cheek, stick out his tongue. The cranial nerve number 8 is the vestibular cochlear nerve. That's the nerve that is responsible for hearing. If we had a tuning fork, we would do the Weber and Rhine test, and where I would strike the tuning fork and place it on the occipital bone and ask the patient to tell me when he can no longer hear the vibrations, and then I would place the tuning fork in front of his ear and ask him to tell me when or if he can still hear the vibrations. And that's the Rhines test, and a normal finding would be air, hearing in front of the ear is greater than bone conduction. And then the Weber test would be to strike the tuning fork and place it in the center of the head and see if the patient hears the vibrations in one ear greater than the other. A normal finding would be that the patient hears the vibrations equally. So since we don't have a tuning fork, I'll just kind of stand behind the patient and whisper phrases and see if the patient is able to accurately identify those phrases. Okay?
99. 66. 77.
Okay, that is correct. And we'll check the other.
Apples and oranges. Fig trees. Louisiana.
So the patient was able to accurately identify the phrases. So cranial nerve 8 is said to be intact. We're gonna move on to cranial nerve 9, the glossopharyngeal, responsible for swallowing. Can you take a big swallow of this, please? Good. So it's said that that cranial nerve is intact. The patient had no difficulty swallowing. We're gonna move on to the gag reflex. Can you open your mouth? All right. So the gag reflex is intact. And that's cranial nerve 10. I'm sorry, cranial nerve 10. We're going to move on to the cranial nerve 11 accessory, and that's head and neck, head and shoulder movements. So I'm going to apply some pressure. I want you to turn your head towards resistance. Good. Good. And shrug your shoulders up. Good. Cranial nerve 11 is intact. And then cranial nerve 12, hypoglossal. With that one, I'll ask the patient to put his tongue, use your tongue to touch the insides of your cheek. Stick out your tongue. All right, so cranial nerve 12 is grossly intact. We completed the Romberg heel to shin. I'm going to ask you to stand with your eyes open for 20 seconds. Okay, so no shift. I'm going to ask you to stand with your eyes closed for 20 seconds. There's no shift there, or very minimal. Okay, open your eyes. Can you stick out your hands? Checking for pronator drift. Okay, close your eyes. All right, I'm going to apply pressure. I want you to go against the pressure. The resistance, I should say. All right, that's pronator drift, and the findings are normal. You can take a seat. Okay, we're going to continue to assess Romberg and or pronator drift. So you stand in with your eyes open. Can you now stand with your eyes closed? Okay, the patient is able to maintain the stance. Can you open your eyes? Can you extend your hands forward? Okay, can you close your eyes with your hands extended forward? Okay, and I want you to push against resistance. Okay, you can open your eyes and lower your hands. The findings are normal. I also want to check, can you raise your head to the ceiling? And chin to chest? And from left to right? Okay, so extension, flexion, and lateral rotation is grossly intact. So this will conclude my comprehensive physical assessment for nursing 609. All of the findings were within normal limits. This patient does not have any past medical history. The patient's BMI was 32, so the patient was counseled on weight management, weight loss, to obtain a BMI that's less than 30. The patient is 37 years old, does not have any significant family history that would warrant any health maintenance screenings at this time. The patient does get routine lab work from his primary care physician and reports that all of the blood work was normal, blood pressure and all vital signs were within normal limits for this patient. Health maintenance would be reducing his BMI and remaining up to date with immunizations as we are approaching cold and flu season. And the patient stated that he did receive his flu vaccine last year and a pneumonia vaccine within the last 5 years. Thank you so much. Goodbye now.